Minister, today I would like to raise with you the urgent need for an elective surgery hub at Midlands General Hospital in Tullamore. This is an issue that I have been raising locally since March, and indeed I also sought a direct meeting with Minister Donnelly at the time, following a letter I received from a senior member of the medical team at the hospital, which highlighted the whole issue around this particular case. At the time, Tullamore was inundated with trauma patients, leading to a situation where the facility had zero capacity to offer any elective surgery for knee or hip replacement procedures. It had no access to an elective ward because it had to accommodate and facilitate emergencies that were pouring in through the A&E department. This is entirely unacceptable, as the volume of patients being seen here at Midland Regional Hospital have increased 40% year on year, which by any objective analysis is a huge volume for a Model 3 hospital. The core of the problem resides in the fact that there has been no meaningful rollout or increase of elective surgery capacity within Tullamore or indeed the Midlands for the last decade. While the staff at the regional hospital are working heroically to meet the level of demand, and I want to commend them for all that they're doing, it is unfortunately clear that they now have hit a wall, and that unless there is improved capacity put into the system, things are only going to get worse for local patients who will continue to be sent to other counties to access basic services through the National Treatment Purchase Fund. I am also aware that Midlands Regional Hospital has seen a 29% increase on attendees of people over 75 years, compared to the same period last year. Again, as a result of this, its emergency department has been under significant and ongoing pressure. Scheduled care activity has also been impacted as a result of this increased demand. Minister, what we have here is a major problem with a very clear and simple solution, and that solution would be to provide a commitment to the people of Tullamore and to the Midlands Regional Hospital Tullamore for a dedicated elective surgery hub to the benefit of all in the Midlands region. Without this solution, the knock-on impact to service provision and delayed care will continue to get only worse over time. Government has just announced one of the largest ever budgets for the health service. I am specifically asking here today what fraction of that allocation is going to be directed to Tullamore Hospital, and will consideration be given for an elective surgery hub? Garv Margaret.
The hospital. I just want to say in the first instance, Minister Donnelly with Minister Butler and others have secured record levels of investment in our health system, which is making a difference for patients, families and communities across our country. Over 25 billion euro being spent in 2025, and the recent budget will see a further 180 million euro in new measures, including support for cancer care, cardiovascular and stroke care, as well as rare diseases. And the impact of this investment in healthcare from the government is seen through the very significant achievements that Ireland has made in the last decade when it comes to health outcomes. We're amongst one of the small group of only 7 EU countries where life expectancy is above 82, and we're seeing the impact of that across a number of metrics. But we know we have to do more, and that's why Minister Donnelly has set out a very ambitious capital plan, particularly to address the demand when it comes to surgery and an elective plan within that. And that's why he has set out the development of 4 elective hospitals, 2 sites in Dublin, in Connolly, and the Children's Hospital in Crumlin, 1 in Cork and 1 in Galway. And there are also surgical hubs that are being delivered in Cork, Dublin, Galway, Limerick and Waterford. And that complements the wider focus of this government when it comes to our primary care system, where a lot of patients who would have otherwise presented to A&E are being triaged through community health care and being supported through the community health service when it comes to chronic disease management and a whole other range of areas. We've also increased bed capacity with an additional, we've constructed over 1,000 new and replacement community-based beds across our country, and Budget 2025 has provided funding for 160 new community beds and 455 upgraded community beds. And the funding for this for the future is that by 2031, there's a plan for an additional 3,000 new hospital beds and 350 replacement beds. So this government is providing unprecedented resources supporting the recruitment of frontline workers in healthcare when it comes to doctors, nurses and allied health professionals, but also addressing the capital needs in our health system with a changing demographic. And Minister Donnelly is advancing that through acute hospitals, some of which is in the Midlands region around the wider provision of new beds within the hospital groups. When it comes to your specific question on the elective hospital for the Midlands Regional Hospital, Minister Donnelly will be able to provide further detail on further plans on that. I have set out the briefing I've received on the various surgical hubs and also the elective capacity which is planned, which has a good regional spread. And it's important that patients in the Midlands and elsewhere have access to improved elective care, and that I think the future of overall capital investment will be to ensure that we have greater number of elective beds within our overall hospital system in Ireland, so that the acute hospital system can manage the presentations which occur on a day-to-day basis, and that will allow greater certainty for patients that are waiting for elective care on an ongoing basis.
Deputy Nolan.
I thank you for your reply, Minister, and I know you mentioned record levels of investment, but we need to see more investment in Midlands Regional Hospital Tullamore, and it is disappointing that Minister Donnelly didn't respond to my request to work constructively with him and to have a meeting with him on this issue. I feel that it's a very, very serious issue. Health is important, and when elderly patients cannot access care at their own local hospital, we know there's a problem. When senior medical members of a team are coming to their TD flagging that there's a problem, then there is a problem, because it's not just me saying there's a problem, the medical staff are saying it, and indeed elderly patients who can't access local care are telling me that there's an issue, that they have to go to other counties for elective surgery. That's wrong. That's very wrong. And I would hope that Minister Donnelly will come back constructively and give me the opportunity to meet him about this issue, because I have sought that. And I hope that that will happen, because certainly this is an issue that cannot be ignored. Again, I want to commend the excellent staff at every level in Midlands Regional Hospital who have worked tirelessly to help patients and indeed to reduce the waiting lists. And the waiting list was again reduced last year for the second year in a row. I commend them for that. But that was partially because patients were forced to go to other counties for care. Partially because of that. And I would hope that that situation will change and that government will show more political will and indeed be constructive in listening to other TDs who are only trying to do their best and do the right thing by the electorate as well.
Minister.
Thanks very much, Deputy Nolan, and I want to agree with you on the huge amount of work that frontline staff do across our hospital system, and I commend them in the work that they do in difficult circumstances on an ongoing basis. But I would say is the government's investment in healthcare is achieving outcomes, and there's faster access to services, with the numbers on trolleys over the first 8 months of the year down 11%, for example, and that demonstrates the commitment and the ongoing progress we're seeing in our health system. There's been enormous progress in Tullamore and indeed the Midlands group when it comes to numbers of patients on trolleys, for example, which is demonstrates the investment and the impact that the unprecedented resources and the recruitment of frontline staff is having. Similarly, I know there's further staff plans for recruitment within the Midlands Regional Group and Tullamore for next year, and that again builds on the progress that we've made. When you look at the trolley count in Tullamore, for example, we're really seeing an impact when it comes to wait times. But we have more to do, and that's why with the budget we've secured next year, Minister Donnelly is keen to complement that investment in frontline health workers with capital investment for the future, and thousands of more beds being developed right across the country for the coming years.
Deputy